Most headaches are annoying, disruptive, but harmless. Tension headaches, dehydration, too much caffeine, caffeine withdrawal, stress, hangovers, they all make your head hurt, but they usually don't mean your life is in danger. But sometimes a headache is your internal alarm bell. Headaches that can actually warn of serious, even life threatening conditions like brain aneurysms, bleeding, infection, glaucoma, or very dangerous pregnancy complications. I'm Dr. Venk, emergency physician, husband, and father to 3 incredible boys, and I'm going to walk you through 5 red flag headache situations. The ones that mean don't wait, get checked right away. Let's get into it. If your headache explodes suddenly, like a cannon, this is a red flag. In addition, if this headache is very severe, we call it a thunderclap headache. One moment you're fine, you're shopping for groceries, you're doing your normal activities, and within seconds, you have one of the worst headaches you've ever had in your entire life. This pattern can signal bleeding from a brain aneurysm, and it's a very dangerous condition, one that requires an emergency department visit right away to look into it. So, you might be wondering, how fast is concerning? In general, the faster your headache becomes intense, the more likely that this could be from an aneurysm and bleeding. Generally though, if the headache took more than an hour to get to its worst, this is not considered a thunderclap headache. Within that 1 hour time frame though, headaches that are at their worst within seconds are the most dangerous. Now, should you be scared if this is happening to you? No, please get checked out, but don't panic. Potentially up to 1 in 20 people with one of these thunderclap type headaches will have a dangerous bleeding situation in their head. But that means that most are still okay. Don't get me wrong, it's still too much risk to not go get checked out. You absolutely should do that, but I don't want you to panic. You may be wondering, if the headache was so severe within seconds, but then it fades away after a few minutes, what should I do then? Well, this could still be from bleeding from an aneurysm, and especially if that intensity of that headache is worse than you ever remember having a headache before, you should probably still go get checked out to be safe. Sudden severe headache is not the only situation where we worry about bleeding from an aneurysm in our brain. The other thing that we have to keep in mind is that an unusual headache that occurs while you're having sex can sometimes be a sign of that type of bleeding as well. In fact, in about 1 or 2 out of every 10 situations where people have a sex-related headache, it's from a bleeding aneurysm. For this reason, I call this overall situation the 3S headache: sudden, severe, sex-related. Let's look at another situation. If a headache comes on with new neurologic symptoms or new neurologic problems like weakness or numbness in a part of your body or in the face, vision changes, you're slurring your speech or you're confused, it could mean that you're dealing with a stroke, tumor, or an infection. How common is it to have a headache when someone is having a stroke? If we look at 20 different studies on this issue, they report everywhere from 6% of people up to 44% of people might have a headache when they're having their stroke. But when you pool all those studies together, the truth comes out to somewhere around 20%. That's about 1 in 5 people with acute stroke are having a headache too. Even if those neurologic symptoms only last for a few minutes and then go away, it still needs urgent attention in an emergency department because it could be a sign of a mini stroke, and this could be your chance to step in before a major stroke happens. Remember, it's not just the headache pain that makes this situation dangerous. It's the headache plus what comes with it: weakness, numbness, vision changes, dizziness, speech changes. All of those things combined with a headache, or by themselves even, are concerning. Go get checked out to make sure that you're not having a stroke or mini stroke, especially if you're older, have heart disease, diabetes, high cholesterol, or other risk factors for stroke. Moving on, number 3 on this list of dangerous situations with headache is when a headache is paired with a fever and a stiff neck and light sensitivity. We worry about infections of the brain itself or the covering on the brain, especially if you have a weakened immune system from HIV, chemotherapy, medications, or something else. You are at even more risk of this happening. Certainly, many common infections will cause fever, headache, and neck discomfort. Think influenza, COVID, and more. However, when the neck stiffness is very severe, such that you may be thinking, I can't even move my neck without pain. And when I walk in to see these patients in the ER, if someone is moving like this, where they're keeping their head, neck, and chest all in the same alignment without moving them, that is concerning. Also, if we talk about sensitivity to light, certainly this is a common finding with many headaches, like migraine type headaches. But if this is with fever and headache, and especially neck stiffness, we need to consider that this could be a sign of a much more serious thing, like an infection of the brain itself or the covering of the brain. That's not a wait and see situation. That's a sign you need to go to the emergency department and get checked out right away. Number 4 on this list. If you have a sudden severe headache behind one eye or the other, and you notice your vision is blurred, or you have halos around the lights that you see, this could be a clue that you are experiencing acute angle closure glaucoma. This is a true emergency, just like the other ones we've talked about on this list. In acute glaucoma, the pressure in the front part of the eye is rising quickly, and it can cause permanent vision loss, so you don't want to wait. The headache in glaucoma is typically very severe, abrupt, much like the thunderclap, and is described as a deep, throbbing headache that affects one eye or the other. In addition to acute angle closure glaucoma, headache with double vision, vision loss, or other vision changes can sometimes be related to a different vision-threatening condition called giant cell arteritis. Having a headache with giant cell arteritis is very common, but the intensity isn't quite as strong as a thunderclap headache or a glaucoma. It's more described as moderate to severe intensity, so still very bothersome, but less intense than those other conditions. And it is usually located near a temple. The vision change is variable. People can describe things from vision loss to blurring vision or double vision. So really any kind of vision disturbance that's lasting and is unusual for you should really prompt you to get checked out. Other symptoms people sometimes report with giant cell arteritis includes jaw or mouth or tongue symptoms. So if you're having any of these as well, it's probably also worth that you get checked out. All of these are much more subtle than glaucoma. The take-home point for you is if you have a headache with vision changes, you really should be thinking strongly about getting checked out in the emergency department. You've stuck with me to the final high-risk headache situation. Before we dive into it, if you've learned anything from this list today, please tag that thumbs up button and subscribe to my channel. Also, my wife and kids and I think long and hard about what the next video should be. This video was suggested by my oldest son, in fact, who suffers from classic migraine headaches. You could help us by writing a comment about whatever healthcare topic is on your mind, so then we can spend less time thinking about making videos and actually spend more time making them on the things you care about most. Okay, the 5th situation is a new or severe persistent headache when you are pregnant or have just recently been pregnant. This could be a sign of a disease called preeclampsia. Preeclampsia is a very dangerous situation. It can cause death, or it might mean that your baby needs to be delivered early. The diagnosis involves different tests that can be done in the emergency department or sometimes in an emergency obstetrics area. If you're having a headache that's unusual for you, or it's very severe and persistent while you're pregnant or have just been pregnant, it's best to call your obstetrics team or go to the nearest emergency department right away. It's time to close this down, so I need to reiterate. If you have a headache that is scaring you for any reason, go get checked out. If you are listening to this list and you are worried about any of these conditions and your symptoms are slightly different, don't hesitate to get checked out. Also, if you are watching this and your symptoms fit exactly any of these criteria, I also want to say don't panic. Be safe, go to the ER, get checked out so you'll know that you're okay. In summary, let's review what we talked about. Don't forget the 3S headache: sudden, severe, sex-related. It can be related to an aneurysm in your brain that is bleeding. Headaches with neurologic changes could be a sign of a stroke or mini stroke. Headaches with fever and neck stiffness. Consider that this could be an infection of the brain itself or the covering of the brain. Headaches with vision changes should worry you about acute angle closure glaucoma or giant cell arteritis. And headaches in pregnancy could be a sign of preeclampsia. You are amazing for staying to the end. I'm going to share that QR code that I promised that will link you to the downloadable summary of this entire video, as well as a way that you can track your symptoms so you can have an easier time discussing the situation with your doctor. Remember, smart health fuels smarter living.